Out of my lap. You were just sitting on my lap.
That is true.
It is true. You know, we often say in this program, everybody's got something. And what we hope to do is share our something with you in hopes that it'll make your life a little bit easier. And our dear, dear friend here, Larry, you're going through your something you want to share.
I'm having a little something. It's true. A few months ago, I found out that what I thought was just a strained muscle was actually a symptom of something a lot more serious. So in a couple of days, I will have to have my entire right hip replaced. It was a shock to hear and a decision that took me quite some time to accept. I love sports. I love being active. I love challenging myself. At GMA, I'm always willing to do whatever is needed for the show because I love it. I was a jock growing up from the time I was able to walk. If you're having a stressful day, there's always tennis. Go take it out on that little yellow ball.
She won that Agassi.
That really, to me, is therapy. It really helps me. I was starting to feel little aches and pains. My shoulder started bothering me.
Lara presented to our office with multiple diagnoses. We focused to start on her shoulder and elbow. She continued to report that the hip was more of a problem for her.
I kept thinking I had a muscle pull, and I played on. This hurt. And then I pulled my muscle again, and I played on. And it went on for probably too long. Definitely too long.
Lara came in a time of great deal of pain. Her hip was starting to fail. There was a breakdown in the bearing surface between the cartilage and bone. She's almost bone on bone here. It made the most sense for her, even with reduced demands, playing less tennis, being less active, to have a hip replacement.
It was so upsetting. I was like, what? And he was like, there's not a lot we can do here for you. This is way down the road. And it took me a long time. I was like, no, I'm 27. In my head, I'm 27. So I waited for a long time before I did anything about it or told anybody, because it sounds like it's an old person's problem. And I just couldn't believe it.
I think approximately 10% of all hip replacements are done on patients who are under 50 years old. So that's a huge number of people in that age group we don't really hear about as much.
How can we get her to a point where she's as strong as possible, has as much mobility as possible going into the surgery so we're prepared coming out? She's definitely attacking this like an athlete. She's been hardcore at saying, I want to do everything I possibly can to be as fit going in. Now we're going to layer in some upper extremity work.
Oh my God, it's so hard. This is not easy, but I think it's really important to deal with whatever issue comes your way. Just don't be afraid. If you don't talk about it, you can't fix it. So I'm happy if I can save one person from not having to go through the pain.
Good job.
I did it.
Step down.
This has happened because I've played hard, because I love it. I love moving, and that's what I've come to see, is that I'll be back.
Most certainly will be, and Jen's going to join in on the conversation with us. We saw the emotion, and you've been quite emotional about this, especially when you first got the diagnosis. How are you doing now?
I'm terrified. I just said, oh, face it. I can talk the talk, but walking the walk is not quite as simple. Of course, I'm terrified. I'm terrified. I mean, it was embarrassing to share, and then I realized there's nothing to be embarrassed about. I have a genetic predisposition for this, but if you're athletic and you move, it's happening younger and younger. And
we saw that number is pretty shocking.
Yeah.
I would imagine the fear she's feeling, Jen, that's got to be the most natural reaction in the world.
It's not only common, it's natural, it's appropriate, and not just for a big operation like this. Really, you've heard me say it before, there's no such thing as minor surgery. The appropriate reaction for the vast majority of people having to go into the operating room is this. And I applaud you for being so open about it. I think more people need to hear emotions like this. Like, it's not like getting your nails done, folks.
No.
You're going to sleep, you're getting sedation, you're getting a part of your body taken out or repaired or fixed.
Yeah,
and
do yourself a favor. Do not Google this operation. I made that mistake.
I agree with you, Dr. Spencer.
What exactly happened to her hip?
Well, you know, as she said, she was born with it. This used to be called congenital dysplasia of the hip. Now it's really rephrased as developmental dysplasia. And if you think of the hip as a ball and socket joint, okay, the acetabulum, the hip, the femur sits in that like a ball and socket. Lara has what was called a shallow cup. So if the cup was like this, it's shallow.
I have shallow cups.
Shallow cup. That cartilage. See, you can't laugh. There you go. And as that cartilage gets worn around with normal movement or athletic,
even just saying it's making it hurt.
you get what's called bone on bone. Another way to think of this, you guys, is your driveway. The asphalt on your driveway is like the cartilage in your joints. When you get those potholes in your driveway, it's only a matter of time until you have to replace the whole.
But if you have this predisposition, is there anything you can do to ward it off?
Well, it's ironic, and that's a really loaded question, George, because as we were talking, and you know, the obvious answer is, well, if she wasn't an athlete, maybe she could have gotten to her 60s or 70s without needing this joint replaced. But no orthopedic surgeon, no physician, no one in the sports world or medical world would say, don't be active.
No.
Now, if Lara earned her living seated and didn't participate in any sports, yes, she wouldn't have been feeling this in her 40s, but in some cases, it's only a matter of time.
And it's a good thing that she did not ignore this situation, because that could have led to something even worse.
Well, there's no ignoring it at this point.
Right.
The pain is so chronic. I have such.
But you tried to fight through it for a while.
I did. I absolutely did. And I got cortisone shots, and but the doctor said, you'll know, and boy, do I know. And I just want to say to anybody out there who suffers with chronic pain, I feel you. It takes over your life. It takes over. It affects you emotionally, mentally, physically. You cannot sleep. It's hard to think about.
Fatiguing.
It's gnawing at you all the time. And what I wish I would have done is just taken care of this sooner and spoken up. But I, was like, I can handle it.
Right.
And did you have any pain in your back? Or
well, that's the thing, and it will lead to problems. It would have led to, if I didn't do this, they said for sure I would have back problems, and it could lead to knee problems. And I'm starting to walk differently.
And good news, the incision usually is about this big. You're going to be weight bearing and walking day of surgery, 3 to 6 month rehab, but you are going to kill it.
Yeah.
You see how amazing your body is.
So when are you're having this next?
It's on Saturday morning.
Okay.
Yeah, so I won't see you guys for a couple weeks, and then I'll come running back.
Something tells me we'll be hearing from her during those 2 weeks.
Yeah.
Thank you for sharing that, Lara.
It's my pleasure. I hope it helps somebody else
Sure it
out
has.
there.
I'm sure it will. Coming up, we're going to be live in Rio with Olympic gold medal swimmer Connor Dwyer. You were a diver.
Yes.
Yes. Yeah.